This presentation, we're going to talk about the patient Patrick. Well, the question one is the factors that contribute to the respiratory symptoms. The smoking and aging are the main contributing factors of the respiratory symptoms. The smoking is modified factors and the aging is non-modified factors. Patrick has a 40 years history of smoking, which is an important cause of respiratory disease. Harmful substance in tobacco can damage the alveoli and destroy the elastic recoil, which lead to the gas exchange function of the lung reduced. But every organ in the body needs oxygen, which increases the respiratory rate to get oxygen. So when breathing faster and deeper, Patrick will have the symptom of the difficulty breathing. In addition, age is an important factor as well, and many functional tissues and organs will worsen with the aging. In muscles that support breathing, the diaphragm will become weak and prevent enough air to breathe in and out. Moreover, changes in bone and muscle may reduce oxygen level in the body and remove less carbon dioxide. Therefore, it may cause symptoms such as fatigue and shortness of breath. And in question 2 is factors which contribute to the heart rate. In this picture, we can see that the stroke volume is limited. The heart will increase because cardio output increase a lot. There are several factors that contribute to the cardio output increase. One is obesity, another one is dyspnea, and myocardial infarction history, and also the less hemoglobin. This all contribute to the cardio output increase because the body, the other part needs the blood vessel. So the heart needs to pump with small effort to ensure that there is enough blood to supply the various organs, which lead to an increase in heart rate. It also can say that the Patrick is suffer from the hyperglycemia, which means that the Patrick heart need to push much more effort to make the blood circulation normally as normal people. And then is a question 3. The factors that contribute to the COPD and the left side heart failure and the relationship between them. Well, as explained before, the COPD factors have two. One is smoking and one is advancing age. They causes the inflammation and alveoli damage, which decrease the elasticity of alveoli. This is the main causes of COPD. And also, COPD may cause pulmonary hypertension, pulmonary edema, and hypocapnia. The reason is that the inflammation in bronchial causes a chronic bronchitis, which also is a part of his COPD. The swollen leg explained by the fluid retention associated with the bronchitis and the pulmonary edema. The body needs more oxygen typically, while other parts need more oxygen by the blood volume. Thus, the blood vessel will constriction to increase the blood pressure. This causes pulmonary edema. The backflow on left ventricle increase because the patient had the myocardial infarction. The left heart failure wasn't by this. And also, the hypocapnia is caused by COPD because the oxygen is deprivation, and also this is caused hypoxia, and carbon dioxide increase leads to the hypocapnia. Those three contribute to the left side heart failure of the Patrick. Based on the Patrick had the myocardial infarction before, so the COPD wasn't the Patrick left side heart failure.
Right heart failure is a complication of COPD and left heart failure. The heart and lungs are closely connected and working together to provide oxygen and get rid of carbon dioxide for body. COPD results in low oxygen in alveoli, which causes the pulmonary artery to constrict, leading to the pulmonary hypertension because of increased pressure in the pulmonary artery. At this point, the right heart will pump more strongly to the blood supply to pulmonary artery, which will lead to the dysfunction of pumping blood. The reason is that over a long period, the right ventricle will be enlarged. That is why right heart failure is caused. More than that, a worsening left heart failure indicates that the left heart is not pumping properly. The left ventricle is responsible for pumping oxygenated blood to the body, cells, and tissues. When it is pumping inefficiently, blood stores in the left atrium and lungs, resulting in the shortness of breath. Therefore, it faces a high risk of right heart failure due to the accumulation of blood in the lung circuit. Excessive pressure is applied to the right side of the heart to maintain the cardiac output, which puts extra pressure to the right ventricle, which makes it necessary to pump the blood harder, thus causing the right heart failure.
Based on Patrick's blood test result, his sodium level is high. This may be caused by salty diet and low fluid intake, and sodium cannot be released from body. Because Patrick's age, his kidney will reduce its function, his thirst mechanism will be less and becoming dehydration. Hypernatremia can cause muscle twitching or spasm, also causes fatigue and confusion because electrolyte of sodium is not balanced and lack of energy. Potassium concentration in Patrick's blood test is a little bit high. This may be caused by the medicine that Patrick is taking for his COPD. The medicine could prevent renal excretion of potassium. Hyperkalemia can cause abnormal transmission of electrical signals in the body and may cause anxiety and irregular heart rhythm. Calcium concentration is low in Patrick's blood test. This could be due to low calcium diet and not enough vitamin D in the body. History of smoking, obese, and hypertension can cause deficiency of parathyroid hormone or renal failure, and less calcium can be reabsorbed. Hypocalcemia can cause muscle spasm, tetany, cognitive impairment, and mental health disorders. Low level of hemoglobin can be caused by lack of nutrient, and the body cannot create enough hemoglobin. Because of his age, his bone marrow might lose its function, and less red blood cells will be produced. As he got history of smoking and medicines might lead to kidney disease, which can also cause anemia. Anemia can cause less oxygen delivered into the body, which can lead to dizziness, tiredness, confusion, and depression. LDL, HDL, and triglycerides, they are associated with each other when HDL level is too low in the bloodstream. LDL and triglycerides level will go up. His story of smoking, obese, and his unhealthy lifestyle can be the factors. Low level of HDL, high level of LDL, and triglycerides cause the lipid to block the arteries, which can cause stroke, memory loss, dementia, and depression. Patrick might have less exercise, obese, or more carbohydrate intake, which cause his blood glucose level goes up. Another reason is that Patrick might have type 2 diabetes caused by his unhealthy lifestyle, which cause his blood glucose level goes up. Hyperglycemia can lead to fatigue, headaches, trouble of concentration, and blurred visions. The additional blood test result we found is creatinine. In Patrick's case, creatinine level will be above the normal level. The normal level of creatinine is between 0.6 to 1.2 milligrams per deciliter. As mentioned before, Patrick might have kidney disease. Creatinine in the blood cannot be excreted out from the body and causes creatinine level goes up.